Hi, this is Brian Kim. I'm going to share with you case number 87 in the best way to do cataract surgery series. This is a patient with an average lens density, and it's a little bit of a sticky consistency, so you have to really be careful with your lens disassembly. And you'll be able to see double chop, cross chop, and systematic lens disassembly of this sticky lens. So I'm using a cotton tip to steady the eye, and then using a corneal marker, which will help me to center and size my rhexis. While I'm holding the eye with a cotton tip, I make my paracentesis incision, first on the right side and then the left side. You can see this patient has a pretty significant posterior subcapsular component to the cataract. This is some intracameral lidocaine, and then now some dispersive viscoelastic to flatten the anterior capsule and to coat the corneal endothelium. With the cannula in place, I like to make my triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel through the cornea, and using the cannula to control the eye, I turn the eye towards me, and then I enter. I push some more dispersive viscoelastic before I come out. And this is my puncture style Capsulorhexis. I puncture the center and pull downward towards me. Make sure I grab the right side of the tear and then begin the flap. Going around circumferentially, trying to maintain a well-centered and sized rhexis using the previous corneal marks that I made as a guide. This is the Capsulorhexis hydrodissection technique. I place the cannula out to the equator, point the tip down towards the nerve, get a nice wave, decompress on the left side, point the tip down on the right, and then I'm able to spin the lens quite nicely here. So we'll go ahead and begin the phaco. I'm just irrigating the surface of the eye, making sure the sleeve is the right length that I want it to be. Lift the incision with a chopper, go in with irrigation off to minimize Descemet's trauma. Remove the surface epinuclear material, place the chopper underneath the rhexis edge contra-incisionally, placing the phaco tip vertically sub-incisionally, bringing both instruments together, crushing and dividing the lens, that's double chop, placing the chopper around the right heminucleus, dividing it in half, that is the cross chop. Pulling the first piece up with some vacuum and using the chopper as well to lift it up, crushing the lens and then emulsifying the lens pieces. Placing the chopper around the second quadrant there, pulling it centrally toward the phaco tip, crushing it and then going around the lens again and then lifting it up and then crushing between the chopper and the phaco tip and emulsifying the lens pieces. I'm spinning the second heminucleus in front of me, placing the chopper under the rhexis edge around the lens, pulling it centrally towards the phaco tip, dividing that second heminucleus. Using a little bit of vacuum to lift that third quadrant, crushing it between the chopper and the phaco tip and emulsifying the lens piece. Doing the same thing for the fourth quadrant, bringing the chopper around the lens piece, pulling it centrally toward the phaco tip, crushing it, and emulsifying the lens pieces. And that's the basic maneuver I do for all the cases. It makes it so easy because you're able to hook the lens and then chop it, and there's no worry about being able to pull the lens up out of the bag. So the epinucleus comes out quite nicely here. I take the chopper out, push BSS in, take the phaco tip out, and I go in with the INA handpiece. I always start sub-incisionally here, grabbing the cortex from anterior to posterior. And this polymer tip is really very nice, and so I used to have to do a lot of sweeping side to side, but these newer generation phaco machines are so good. The aspiration and vacuum are so responsive, and that's why you're able to remove the cortex so efficiently. Switch to polish mode and removing all the lens epithelial cells and the cortical material underneath the rhexis edge. As well as polishing the posterior capsule surface. It's not that obvious on the screen sometimes, but there's some fine lens material that's adherent to the posterior capsule. I always go after that stuff. Once I'm done with that, I'm going to go in with BSS cannula and pulse into the subincisional capsular fornix there. I turn the INA tip away from it, and then I pulse. It was pretty clean. Now I'm placing some cohesive viscoelastic to fill the bag. As I do that, I switch to the capsule sweep. Go ahead and sweep underneath the rhexis edge to remove any more lens epithelial cells on the left side first, and then on the right side. So this is a single piece acrylic intraocular lens using the sweep to hold the eye. I'm able to place the tip within the incision. The leading haptic goes inside the bag, and as the optic unfolds, I go in with the INA handpiece. I go in with irrigation off, activate irrigation, go underneath the lens, tilting it, rotating it 90 degrees, removing all the viscoelastic from within the bag. By doing it this way, I'm able to make sure that both haptics are within the bag. I polish underneath the rhexis edge as well. Invariably, with these maneuvers, you're able to liberate some more fine lens material. And while I'm doing that in polish mode, I go ahead and turn the haptics in the horizontal meridian. And then I switch to visco mode, removing the viscoelastic from the anterior chamber. And then I'll hydrate my incisions. So again, this is an average lens density. You can see the CDE was pretty minimal. You saw systematic lens disassembly using double chop, cross chop, mechanical fracturing techniques, hooking the lens at the level of the equator, pulling it centrally towards the phaco tip, using both instruments to crush and divide the lens pieces. And by using both instruments to mechanically crush the lens and divide it into smaller pieces, you're able to use sparing amounts of ultrasonic energy. This is a very controlled way to do things because by hooking the lens up out of the bag, you don't have to go after it with the phaco tip and trying to grab the lens pieces with high vacuum. That's when invariably you can run into trouble. So I hope this was helpful to you, and I thank you for your attention.